2012, there were 35.3 million people living with HIV worldwide. But on a more positive note, new cases have dropped by 33% since 2001. This week, Bangkok is hosting the 11th Annual International AIDS Conference, and we've come along today with Sompong Chareonsuk from Unaids to find out more. Thank you, Sompong, for joining us today. Can you tell us a little bit more about your organisation, Unaids, please?
My organisation is the Joint United Nations Program on HIV/AIDS, and this program is supported by 11 UN agencies, and we call them Unaids co-sponsors. And this program is globally operating. Our headquarters is in Geneva, and we have a country office in Bangkok. In the meantime, we also have a regional support team offices in Bangkok as well, in the same building and what we call UN compound, but they are on the different floors. So our organization is the United Hands on AIDS. In other words, that we have been asked by the co-sponsoring agency to deal with HIV/AIDS for them. So we're working closely with them. We get funding from them, and we get a lot of different kind of support from them at each level, country level, regional level, and global level. So we address the issue related to HIV/AIDS globally, regionally, and nationally.
And what progress has there been this year with regards to HIV and AIDS research?
In terms of HIV, I may start with the national level, which is I'm actually looking after Thailand. And Thailand is considering as a leading country in response to HIV/AIDS. And for example, the area of treatment, Thailand is very well advanced in terms of providing antiretroviral drugs. And the drugs are quite cheap compared to in many countries. And also the technologies that we have also developed. For example, the medical doctors here, the nurse here, they are well equipped to look after the people with HIV. And in the meantime, the policy-wise, the government here also have a lot of policy. Recently, the government issued a policy on providing ARV or antiretroviral drugs to the migrants by issuing health insurance card. So this is very, very well advanced compared to many countries in the world. And we also have other area in terms of advancement. For example, prevention from mother to child transmissions. So Thailand has been able to reduce the rates of transmission down to below 2%, which is really one of the very few countries in the world. So therefore, Thailand has been a place where many countries, neighboring countries, African countries, come to learn from us.
And despite this progress, which is wonderful to hear about, what are the immediate challenges, or what's your immediate plan for the next 6 months?
So I may add a little bit in terms of data information. For example, we are able to reduce the infections from 140,000 in 2001 or even before to down to only about 10,000 last year. So this is the statistic showing that we have done very well in terms of prevention. And we have reduced a lot of infection also among for example, client and sex workers due to the 100% condom programs, which is quite well known. However, the statistics show that the pattern of behaviors of some group of populations have changed. For example, sex work is no longer in the bottle settings. Sex work pattern has changed totally. So, and many of them are on the street, and many of them are even have their own setting, like a telephone call business, something like that. So we have to do something which is not the business as usual. We have to do something differently. In the meantime, the Asian epidemic model group have indicated that the key affected populations must be targeted. For example, the men having sex with men in Thailand, especially in Bangkok, is go up almost 30% in terms of prevalence. And also the injecting drug users, which is also one of the very what we call hardship people and very harsh to rich people. And there are so many barriers, legal barriers. They are still considered as a criminal, and needle exchange cannot be done in the country because due to policy hasn't been really yet formally passed through the system in the country. So these are the things that are challenges for us, whether we can get the comprehensive package on harm reduction for the people injecting drug use, in editing drugs, and whether we can actually reach MSM or men having sex with men people and provide them early testing so that they can have early treatment, for example. And you know, this is to support the scientific proof saying that early treatment can also prevent transmissions, which is almost 96%. So if we can have early counseling testing, early treatment, so we will actually achieve prevention.
So we're here today at the 11th Annual International AIDS Conference. Which other delegates are here? What type of organisations are here with you?
For UNAIDS, the delegates we supporting either through our co-sponsoring agencies, either through the national partners like the Ministry of Public Health, civil society organization. So there will be national program managers from each country, key leaders from civil society, for example, faith-based organizations, even sex work networks, IDU networks. You know, we have supporting them to come in order to share experiences. But of course, you know, physicians, nurses who have been involved in HIV/AIDS for a period of time, that they also would like to come and learn from others and share with others. The lesson learned sharing here ranging from like few years and 30 years experiences. And Thailand, even about universal coverage, is a big lesson learned for many countries that they would like to learn from.
What's the platform of the conference this week? What objectives are you hoping to set?
You may have heard about getting to zero. All countries in the world and the countries in Asia and the Pacific have agreed in order to achieve what we call getting to zero. Getting to zero is actually a visional goal, right? That would encourage people, encourage the society in the region, not to be careless, because many thought that there's not enough awareness, meaning, you know, there's no more HIV/AIDS, but that's very dangerous. So we set the goal in order to convince our member states, you know, to come up with innovative approach to combat the HIV/AIDS, and also to get advanced in terms of technologies in order to achieve getting to zero. But for some countries like Thailand, we are now having a strategy to end AIDS. So in 2020, we would like to end AIDS. We want to normalize AIDS response into a normal or routine units of service.
And lastly, how's the conference been so far for you this week?
This is actually the very first day, because yesterday we had an opening, and this morning there was the first plenary, and we got crowded of audience, and there were so many medical experts and leaders share their opinion and vision. So a lot of people that they are quite encouraged to move forward. However, there's still a few days, until Friday, And a lot of issue needs to be covered still, because when you say getting to zero, new infection, zero deaths due to AIDS, and zero stigma discrimination. So when you look into detail, there's a lot of things that needs to be addressed under these 3 zeros.